Quite often, I will get patients who will ask me, Dr. Selma, do you take supplements? If so, which ones do you take? So there's about 6 supplements that I take on a regular basis. So other than drinking my matcha tea and my mushroom tea, there are 6 supplements that are my staple supplements that I take that are usually in my office. I leave them in my office because it's easier for me to remember to take them there. So I'm going to go over my 6 supplements and also why I take them. So let's start with my omegas, my omega EFAs. So I take omegas, basically one of the most important supplements that I can take, and probably you too. They have many potential benefits for your cardiovascular health. And one key benefit is that they do lower your triglyceride levels. And if you have too many triglycerides in your blood, that can raise your risk of arteriosclerosis, and this can increase your chance for heart disease and stroke. So this is one of a very important supplement that I take. Let's see here. My next one that I take is a nattokinase. So I don't know if you guys know about this supplement, but this is a great supplement. In fact, Dr. Gary and I were talking about the benefits of nattokinase, and he was telling me about a study that he heard about how it helps with your arteriosclerosis and cleaning out the plaque from your arteries. So there's so many studies on this supplement here, but nattokinase is one of my favorite ones. This is wonderful for blood stagnation, and a lot of my patients will know that I talk about blood stagnation all the time because in Chinese medicine, blood is the chief of all fluids, and if blood isn't moving, then it's going to be hard for you to heal and to get better from any of your illnesses. So this is a great one for blood stagnation. It's not only great for circulating blood, but it's also great for preventing heart disease. And as I talk with a lot of my women patients about heart disease, it is that #1 killer of women. It's that silent killer. So this is a great one to help lower your blood pressure. It can also reduce the strain on your heart, which can cause a heart attack. So this is one of my favorite ones right here, nattokinase. Let's see here. I also have a multivitamin. So we all know that our soil is depleted of nutrients, and I used to be one that did not want to take a multivitamin because I thought, I can get it all from the foods that I eat. I try to eat healthy. I eat good foods, greens, different colors of the rainbow. But again, our soils are so depleted of nutrients. Even if it's organic, it is so hard to get the nutrients that people would get from their food even 20 years ago. So I take a great pharmaceutical grade multivitamin. These are the ones that we carry here in our office. These have no fillers. These are going to be great. They go right to the bloodstream. There's no soy, no fish, no shellfish, things like that. No, this is also gluten-free. So very good multivitamin that is a pharmaceutical grade supplement. So I love this one right here. I take this one on a daily basis. Another one I have is Immune Plus. These are Chinese herbs. These are Chinese herbal formula. I take a lot of different Chinese herbal formulas. It also depends on what's going on. Like when I got back from Africa, I had an infection from the bites that I received. So I took a Chinese herbal formula antibiotic. So I took a Chinese herbal formula antibiotic. It does not have all of the gunk in it that you'll find in the antibiotics that are prescribed from your MD. So I took that one. I was fine. I was cleared up. So, but this one right here is my Immune Plus. This one here flies off the shelf in our office. This is great to keep your immune system strong. This is great if you are around people who get sick a lot and you don't want to get sick. My staff takes this one. I love this one here. This one's Immune Plus. It's a Chinese herbal formula. Next is our Megaspore Biotic. So I take, definitely, I think this is great for everyone to take. I take a probiotic just to help with the gut issues. As we all know, the gut is very, very important in our immune system and also just with the functioning of our body's systems. So I always make sure to take a great, very good high strain probiotic. And also vitamin D. So I take vitamin D drops. I love this one here. Our staff takes this one. A lot of our patients take this one. We love it. It works really fast. As you know, we live in an area where we don't get a lot of sunlight, especially in the wintertime when our days are shorter. Most people are vitamin D deficient. Even if you think you aren't, you probably are. So it's always good to have a good, strong pharmaceutical grade vitamin D supplement. And I also stress to my patients, never take an over-the-counter supplement without talking with me or your healthcare provider first. Sometimes you don't want to overdo something. Don't take something just because everyone else is taking it. You may not need something that's in a multivitamin. So it's always good to ask first. All right, guys. Those are the 6 things that I regularly take. These are ones that are in my office. And if you have any questions, feel free to call our office. You can talk with me. If not, happy supplement hunting. All right, guys, thank you so much for watching.